So what's happening in these two, emphysema and chronic bronchitis? First of all, emphysema. Anybody know what's happening inside the lung tissue in emphysema? Well, it's happening in those alveoli, right? And all those little alveoli of your lungs are normally covered in elastic fibers. We mentioned how elastic recoil of the lung tissue is what is the driving factor of expiration in normal relaxed breathing. Well, in emphysema, whatever it is you've been exposed to for years, whether it's tobacco, smoke, or one of the other things that we mentioned, that results in the destruction of these elastic fibers. So the effect is that the lung loses its elasticity, and what will a person with emphysema notice about their breathing?
They can't breathe out.
Yeah, it's difficult to breathe out. We experience expiration as a passive process. There's nothing that we need to do. But with greater and greater damage to lung elasticity, expiration becomes an active process where they have to forcefully push the air out with each breath rather than just let the lungs recoil as a result of destruction of the elastic tissue. So what kind of happens then, especially if they're not getting all of the air out, is when air comes into the lungs, oxygen diffuses with the bloodstream, carbon dioxide comes back in, right? In a healthy lung, all of this would be blown out to be replaced with fresh air again. But in emphysema, maybe only half of it gets out. And so the alveolus remains half full with stale air, so to speak. And you can result in lower oxygenation and that kind of thing. And with decreased movement of air, you also put yourself at greater risk for lung infections too, as bacteria can more easily set up in there. There's some, characteristic appearances too. Because the lungs remain partially inflated most of the time with emphysema, these people tend to take on kind of a barrel-chested look. If you look at the skeletons that we have here, you see the ribs on the side, they kind of angle down and come forward with inspiration like this, right? Well, if your lungs stay inflated most of the time, you end up with this more barrel-chested appearance. Chronic bronchitis, again, same major risk factor, tobacco smoke. But in the case of chronic bronchitis, what happens in these people is that this frequent irritation results in a chronic excessive production of mucus. So these airways are consistently producing mucus, they are inflamed, so that's where you get this productive cough. You get frequent infections because the mucus is helping hold the bacteria in there and all of that. Trouble breathing, and you see this is where the two come together. Hypoxemia, so a low oxygenation of the bloodstream. Respiratory acidosis, as you're not able to get rid of all of the carbon dioxide effectively, and eventually probably respiratory failure.
So the chronic bronchitis isn't, it will never go away even if you stop smoking or whatever the irritant is?
Well, it is considered irreversible, but with most of these things it kind of depends on what stage you catch it. If you catch this really early on and make immediate changes, then I would say that you might be able to reverse it. But if it's fairly well advanced, then it's probably just going to continue. What you can do, though, is stop the progression.
Okay.
So prevent it from getting worse or slow it down from getting worse. I remember when I was in college, my grandpa, he had been a smoker his whole life. He smoked a pipe. And when I was in college, I guess, they diagnosed him with emphysema. My grandma had been nagging him to quit smoking since the 60s, when all this stuff came out. And so he finally gets emphysema, and she goes, something along the lines of, okay, now are you going to quit, now that you see what it's done? So, well, it's too late now, why should I? A lot of people, I think, take that same attitude when it comes to this.
That's what I was wondering, how many people just keep, because they're so addicted?
Well, probably because they're addicted, probably they're also stubborn, and sometimes resigned,
Have you seen
My
it?
grandpa died at 77, and he always talked about how for the year that he was born, the average life expectancy for a male was like 68, so he just considered those bonus years, you know. So people are like that, you know.
There's a little ad sign. I don't know if you guys saw it. That was like floating around on Pinterest and stuff. I think it was a "Don't Smoke"
Mhm.
ad, and it said 1,000 men will die today from stubbornness, and then someone went on there and graffiti. No, we won't.
Yeah, that about sums it up. I saw something like that. It was a billboard about prostate screenings.
Maybe that's the
Yeah.
one. I just remember the "No, we won't."
So here's asthma. Like we said, it's sort of like COPD, except for it is episodic. So the individual symptoms, they're reversible in the way that you have an asthma attack and then it goes away. But a lot of the rest of it's the same. It is an obstructive pulmonary disease resulting in difficulty breathing. This comes in a wide variety of severity. So as we mentioned before, for some people this is just an annoying thing that they have to deal with. In other people it's potentially life-threatening. There's also a variety of triggers for asthma in terms of what sets off an asthma attack. Some people's asthma can be described as allergic asthma, where some inhaled allergen sets off an attack. In other people, it can be psychological, where some sort of mental state can set off an attack. In other people, it appears more random and they have no idea why it's occurring. So it just sort of depends. What's happening is, in the small airways, you're getting a combination of constriction and inflammation. Constriction means that the muscles surrounding the airways are contracting. There's smooth muscle in the airways that's supposed to regulate the diameter. You know, allow it to expand when you're exercising, go back down at rest, just to meet need. But in the case of an asthma attack, you get an overconstriction, and that thing clamps down real small. In addition, the inner membranes of the airways are becoming inflamed and swelling up. And depending on the severity of your symptoms, that can result in really dramatic narrowing of the airways. And of course, we call that an increase in obstruction. And what kinds of things do we do to treat asthma?
And the inhalers.
They have the inhaler. The classic medication in the inhaler is albuterol, what we call a sympathomimetic, meaning it mimics the effects of the sympathetic nervous system. In a normal, healthy person, what effect does the sympathetic nervous system have on airway diameter?
I'm guessing it opens it up.
It opens it up, right? Think fight or flight, exercise, that kind of thing. Don't you want more air movement during those situations? Yeah. So sympathetic causes bronchodilation, and that's the goal of those emergency inhalers. They've got more long-term control medications these days too. Often they're things like inhaled steroids. Steroids are anti-inflammatory in most cases, so they decrease that kind of thing. Other disorders include tuberculosis, an oldie but a good one. Not too many people getting tuberculosis, at least in the developed world anymore. But this used to be one of the major causes of death, especially in, like, how'd you describe that time period? Like late Renaissance and then into the Victorian ages, you know, 16, 17, 1800s, during that time period, especially in Western Europe and to some degree in the United States too. Tuberculosis was one of the major killers of people. I think I read something that approximately 1/3 of all deaths in Victorian England were from tuberculosis. So it was a big deal. And if you guys are familiar with Western lore, the famous Doc Holliday died of tuberculosis. You guys remember the movie Tombstone? Awesome movie. If you haven't seen it, you can watch it.
I saw it long time ago.
Yeah.
So why do they remain so fixated on it now? Like if you work in the hospital or to become a nurse, you have to do the
Well,
TB
the thing
testing
is,
so frequently?
it's not eradicated. There's a lot less of it, but it's not eradicated. Let me explain the disease a little bit, and then we'll talk about why we're still so fixated on it. Okay. So tuberculosis is caused by this bacteria called Mycobacterium tuberculosis. Easy enough. As bacteria go, this one is kind of weird because compared to other bacteria, it grows really, really slowly. So it has a very long mitosis time compared to other bacteria. I guess it's technically binary fission, but you know what I mean. So it divides and grows very slowly compared to other bacteria, which may sound like a good thing when it comes to diseases, but it's actually making it a lot tougher in terms of treatment. So first of all, here's why. If you inhale some of this bacteria, get it into your lungs, and it starts an infection, because it grows so slowly, it's going to be a long time before you exhibit any symptoms, right? But during that time, aren't you also contagious? Mm-hmm. Yes. And in addition to that, only about 1 out of every 10 people who gets exposed to the bacteria will actually start an active infection. So you may not even realize you have a disease because A, it's growing very slowly, B, 90% of the people who come into contact with you won't get it, but the other 10% will. Without treatment, once you have an infection, it does become fatal. So there's that. Also, it's hard to treat because most of the antibiotics that we use this cell division point in the cell cycle to interfere with it, right? And if you're dealing with a bacterium that doesn't divide very frequently, that makes it essentially resistant to a lot of the antibiotics that we use. And if you get, you know, just some standard run-of-the-mill infection and you're given broad-spectrum antibiotics, typical course of treatment's about 10 days usually, right? You take the antibiotic for about 10 days, and we consider that to, you know, be enough to clear most bacterial infections. Tuberculosis, you need to be on antibiotics usually for a full 12 months because that's how long it takes to make sure that you're getting in there and getting all of those different bacteria. So a full year of antibiotic treatment to clear a tuberculosis infection. Besides that, there are resistant strains too that may require a special kind of antibiotic. And if you have one of the resistant strains, not only do you need a special antibiotic, which will of course be more expensive, but you need to be on it for a full 12 months. A course of treatment for resistant tuberculosis is in the $40,000 to $50,000 range. So it's extremely expensive to treat. Like we said, it's not eradicated, not even in the United States. And do you know specific situations or groups of people who are more at risk for contracting tuberculosis?
I know a guy who had it and he was military and got it overseas.
Well, yeah, I mean, I wouldn't have too hard a time believing the military thing, but let me tell you the types of things I'm looking for. People who tend to, or places where there tend to be a lot of people in close quarters and where cleanliness is not that good.
Asia.
Probably, but like in America, what kinds of people fall in that category?
Would that be like
Low
urban
income.
poverty type?
Yeah, so like in the big cities, especially among the homeless populations, tuberculosis is a big problem among the homeless and in prisons too, for the same reasons. And you said the military, and I thought, well, yeah, a bunch of people living in the barracks, you know, close quarters. Probably not the same issues with cleanliness, at least compared to prisons.
But he was in Iraq or one of those. I don't remember specifically which one. And someone that they had gotten, not like a hostage. They didn't really do that, but he had it, and that's how he came.
Well, and so if you're going to work in certain fields where a lot of people tend to be congregated together, they may make you take a tuberculosis test as a result. So you mentioned the hospital, right? When I was in grad school, as like a side job, I signed up to be a substitute teacher for the public schools there. And you had to get a tuberculosis test for that too. So correctional officers, same thing, and for all of those reasons. Do you guys know the older name for tuberculosis, what they called it back in the day? They called it consumption. One of the reasons why is that it causes large areas of tissue death. Now, we think about the lung infection a lot, but it can affect other parts of your body too. Big softball-sized pieces of tissue dying and sort of rotting out. I bring this up because I think it's kind of gross. There's a specific kind of necrosis associated with certain diseases, And tuberculosis, especially in the lungs, but I assume in other tissues too, but especially in the lungs, results in something called caseous necrosis, which means cheesy. And so this stuff turns into like cottage cheese curds that get coughed up. It's real gross. Anyway, bottom line is you don't want it. When we're talking disorders of the lungs, we got to talk about lung cancer too. Lung cancer is the leading cause of cancer deaths in America. So, and this is among both males and females and across all ethnic groups. The biggest cause of cancer deaths is lung cancer. Notice we say cancer deaths, not necessarily cancer cases. Things like skin cancer, prostate cancer, testicular cancer are more common but much less aggressive. So lung cancer is the leading cause of cancer deaths because it's fairly common, especially with people's habits, and it's pretty aggressive too. 90% of all lung cancer cases have a history of smoking. I think that that's pretty common knowledge now. And not necessarily smoking, but we could say, tobacco smoke exposure, because we know secondhand smoke can lead to this too. They've done such a good job of telling us about how smoking leads to cancer that it's easy for people to think that that's the only way that you get lung cancer. But notice, 1 out of every 10 lung cancer cases has no history of smoking. My sister's mother-in-law, a year or two ago, got diagnosed with lung cancer. And of course, if you're a doctor, the first question you ask when you discover someone has lung cancer is about their smoking history, which if you knew this person, you would just laugh at the very notion of. Do you guys remember the Saturday Night Live sketch from the 90s, the Church Lady by Dana Carvey? Oh, that's basically her. Okay, she's this person. I wouldn't smoke. Those are the devil's, the devil's cigarettes. And anyway, so she got lung cancer with never having been exposed to tobacco smoke. Do you guys know what the second leading cause of lung cancer is besides smoke inhalation?
Asbestos?
Well, asbestos causes a different type of cancer. We wouldn't really call that lung cancer. It's called mesothelioma, and it's technically affecting the pleura. So, it's exposure to this stuff called radon. You guys ever heard of radon?
Yes.
Radon is a naturally occurring but radioactive element that is not evenly dispersed but tends to be concentrated in particular areas. And so if you're unlucky enough to have your house built over an area of high radon concentration, that is a high risk factor for lung cancer as well. And this person I was telling you about, my sister's mother-in-law, very old-fashioned type of family, so, she did what, you would expect the mom to do, all of the household chores and stuff like that. And radon is a very heavy element, right? So where in your house do you think you have it to the greatest degree?
The basement.
The basement, down where people keep the laundry room and all of that stuff. And so she had the greatest amount of exposure to all of this radon as the homemaker in that case.
That was a big thing in Kansas when we bought our house.
Radon?
Yeah, they were like adamant when we bought a house in Kansas both times. We needed to do radon testing.
Yeah, well, and now, and I don't know why it took so long to get this figured out, but now, that's really important as part of a standard home inspection, especially if geologically it's known to be in high concentrations there. But of course, they recommend houses have smoke detectors and have for years, but now they're saying, yeah, you also need to have the carbon monoxide and the radon detector because it is you would have no idea. There's no smell, there's no feeling associated with it, there's no anything unless you have a detector, and it can prevent lung cancer. So let's move on to here. Cystic fibrosis. I may have mentioned this one before. This is important to me personally because this runs in my family. Cystic fibrosis is a recessive genetic condition. Now, what do we mean when we say recessive?
Is that where you have to have both
Right.
copies?
You have to inherit 2 copies to express the disease. If you only inherit one, you're a carrier. And one thing that's common in recessive genetic diseases is that they tend to hide themselves in family lines for a long time, especially if it's not super common. So cystic fibrosis is the most common lethal genetic disease in North America, but there aren't that many lethal genetic diseases. So as I said, this is in my family, which we found out about 8 years ago because my older sister and her husband had their first child. He got diagnosed with cystic fibrosis. And well, neither anyone in my family nor anyone in my brother-in-law's family had any idea that cystic fibrosis was in there. But they just happened to be unlucky enough that they were both carriers, and their first child inherited both copies and had the disease. Unfortunately, cystic fibrosis is universally fatal, so if you have it, you will die from it, but life expectancy among is getting better. I can remember when I was in elementary school, one of my classmates had cystic fibrosis, and they had somebody come in and explain to us what his condition was and all of that, and I remember them telling us that he would be lucky if he lived long enough to graduate high school with us, which he did not. But now, with advances in treatment and stuff, life expectancy can reach into the 30s sometimes for people with cystic fibrosis. What cystic fibrosis does is affect mucus production. And what it ends up doing is producing excessive mucus that is also very viscous, thick, and sticky. Which doesn't sound like much, but it manifests itself in some really significant ways. So we're seeing it here in the respiratory system because most people associate cystic fibrosis with breathing problems, which it definitely has. Those mucus-producing airways there, they're producing a lot of it, and it's really thick, so you're looking at frequent lung infections. My nephew, Ethan, has a persistent infection of MRSA and, what's the other one? I always forget the other one. Pseudomonas in his lungs. It's always there, but comes and flares up from time to time and then sort of settles back down. As a result of the excessive mucus in there, it can make breathing difficult, trying to get enough air in there. But it affects lots of different places besides just the lungs. Anybody know what are some other common symptoms among people with cystic fibrosis? One of the more common ones is difficulty growing and developing because the mucus is also clogging the pancreatic duct. Now, we haven't talked about it yet, but the pancreas is an important accessory organ in the digestive system. It makes a bunch of the enzymes that you use to digest your food. So if that gets clogged, you're not breaking down the food well enough and you're not absorbing the nutrients, and then there's growth and development problems too. Also, and I didn't learn about this last one until someone in my family had the disease, almost everyone with cystic fibrosis is sterile because that same mucus is clogging the reproductive ducts. So when my sister was looking into this because her son had it, she told me that yeah, he'll be sterile too. I didn't know that. And then she says, but I think we'll wait to tell him that until he's out of high school. You know, you don't want anybody thinking they have a free pass, right? It's cool, baby, I gotta see that. Treatments are symptomatic, so there is some genetic therapy being experimented with and showing promise, but it's probably several years away still at least. So right now, treatment is still symptomatic. So they have drugs that help to break down and thin out this mucus. There's manual manipulation. So my nephew, when he gets his therapies, he's got a couple things. There's this big vest that he wears attached to what is essentially an air compressor that rapidly inflates and deflates and essentially just like hits him on the chest really, really quickly, that it wears for about 45 minutes twice a day. And at the same time, there's a nebulizer that you use to inhale the medications too. So there's some inhaled steroid medications, a couple other medications aimed at these mucus-producing cells, and he also has to inhale something called hypertonic saline. Using what we know, what is hypertonic saline? We'll start here. What's saline?
Like a solution
Oh.
of water.
Water in. What makes it saline is that it's salt water,
Oh.
right? Hypertonic means that salt water is very concentrated. What effect does a hypertonic environment have on cells?
Doesn't it show?
Yeah, it pulls the water out of them, right? So the hypertonic saline pulls water out of the cells to help thin the mucus, and it can be broken up by that machine and coughed out. And like we said, there's other problems with digestion, so at every meal he's got to take digestive enzymes since the pancreatic duct is clogging up his own ability to produce them. Luckily for my sister and her family, they've got pretty good medical insurance. She was telling me a couple years ago that they got the statement from their insurance company that in that previous year, the insurance company had paid out $60,000 in medication alone to treat this. So it's, you know, very involved. All right, that brings us to the end of the respiratory system. Any questions on that before we move on?